pain. So I usually see this constellation of people that, it wasn't that bad. So they keep pushing through it. And
Right.
then I feel like between the age of 35 and 55, like it starts catching up.
Okay.
So then women start coming and they're like, suddenly I had this problem. But then if I start digging, I'm like, you didn't
It's
suddenly have
been
this problem.
it's been there for a
The
while.
signs were there. They were just yellow flags instead of red flags. So
Mhm.
I know a lot of people, if they know anything about pelvic PT, they're like, oh yeah, I do my Kegels. And I'm like, oh my gosh,
Right.
it's so much more than Kegels.
Welcome to the Pain Free Pathways podcast. On each podcast, we will explore effective natural methods to alleviate joint and muscle discomfort. From expert interviews to the latest research and practical tips, we're here to help you find relief and reclaim your active lifestyle. Let's discover the power of natural healing together on Pain Free Pathways. Welcome to the Pain Free Pathways podcast. This podcast is dedicated to holistic health and wellness, and I am Adina Verrett, your host. And today we have a special guest, Dr. Tanya Yanok, who specializes in pelvic floor physical therapy. Dr. Tanya felt called to become a physical therapist that focused on the pelvic floor after hearing stories of women whose lives were transformed after treatment. She earned a doctorate in physical therapy at the Cleveland State University and has a wealth of experience in an outpatient therapy setting and also in her own practice. Currently, she focuses exclusively on pelvic floor rehabilitation and is a pelvic floor rehabilitation certified practitioner from the Herman Wallace Pelvic Rehabilitation Institute. So I thank you, Dr. Tanya, for joining me today. How are you?
I am lovely. Thank you for having me. This is great.
Well, great, great. So we were just chatting a little bit before the podcast here, and this um, topic, it is considered a little bit taboo for some people,
Yeah.
and because I guess it kind of reflects a little bit of embarrassment. And people might be thinking, well, why are we talking about this if you're talking about pain-free, Adina? But what I find is, one, people are whole beings, and so we
Yes.
need to address the whole person. And I was just sharing with Dr. Tanya that I had a patient yesterday who just shared her challenges that she was having and was just trying to give her some tips. But I think this is something that needs to be addressed for a whole being person, but also there's issues with pelvic pain. And so I want to have someone on who can share with the audience some things about being able to rehabilitate the pelvic floor and the like. But I do have to ask you, Dr. Tanya, what
Yeah.
was it that really, you said women that you saw, got improvement. What can you give an example of something that you saw and you're like, whoa? I mean, what made you go,
Yeah.
I'm gonna do this?
So yeah, I was turned on towards pelvic PT because of a former roommate of mine. She's a labor and delivery nurse.
Mm,
I said like I was a graphic designer and I was 24 getting back pain. I'm like, ugh, like I want to work on health and wellness. Like I want a second career, none of this anymore.
uh-huh.
So I told my roommate, I'm like, I want to go into PT. And her eyes lit up and she's like, you need to look into pelvic PT. And I'm like, what is that? And it's the best description I ever heard. She's like, we refer out to them all the time. We don't know what they do, but the women come back with the smiles back on their faces. And like it was the
Mm,
most vague and intriguing description. And then
hmm.
um so then I go to PT school and I'm in my first clinical rotation and I was serendipitously paired with a PT in a hospital that had started the pelvic PT program. It wasn't even meant to be. It was just like you're
Oh,
just going into the outpatient, whatever. And I just happened to land with the pelvic PT
okay.
and like the director of it. And
Wow.
so like it was my former roommate, Emily, she's in the back of my head. And so that's kind of been like a little seed planted. So then
Hmm.
I ended with this PT and the first patient we treated with pelvic floor dysfunction, um, together, like it was, as a student, it was like my first rotation. So I didn't know what I was doing. But this woman cried, hugged my clinical instructor and thanked her for giving her life back. And I was
Hmm.
just like, what? And it was because
Um,
like, I mean, I always joke that like the pelvic floor is like this Bermuda Triangle of like no provider goes there because gynecologists and OBs and urogyns, like they know disease, they know how to deliver babies, but they don't know the muscles and like, PTs are kind of in this gray area. Like, how
Mm-hmm.
does everything fit together?
Mm-hmm.
So they don't really know that aspect. But then orthopedics, which would be more of that, they're not allowed to go in that region.
Mm-hmm.
So I
Okay.
always joke pelvic PTs are kind of like, an orthopedic and a gynecologist had a baby, and then you pelvic PT.
Came out of that.
Yeah.
Makes sense. Makes sense.
So so I think it's a big deal. What I saw was, so every time we treated a pelvic patient, they always said, no one has asked these questions. No one has checked these muscles. No, like there were just things that we just are aware of that
Uh-huh.
I'm not saying that other providers don't know any. They know a million things that I don't know. They know how to screen for cancer, deliver babies. I cannot do those things. But when it comes to the muscle, like the, neuromuscular system, it just, that's our wheelhouse, and that's just not something that gets addressed with primary care or gynecology. And these women are just like, thank you, because a lot of times the doctors are like, I don't know what to do, just don't do anything, don't have sex, don't do the sport, don't do.
Oh boy.
So this, like, the first woman was like, I've been told not to do yoga, I've been told not to do this, I've been told not to. And I'm just like, we're like, no, you can, like, let's like ease you back into it. Because
Mm.
if there's pelvic floor dysfunction, usually there's hip stuff or sacral iliac joint stuff. And if it's worsened by twisting, they're like, well, don't do your yoga. And if it's worsened by impact, they're told, don't go running.
I see.
Like, then it becomes a snowball, because then they
Mm.
don't have a positive outlet for their negative
Mm-hmm.
energy. So then they're getting deconditioned and they're gaining weight, and like it just snowballs. So that's
Right.
what I see when I hear women say, you gave me my life back.
Oh
A lot
wow.
of fear avoidance behavior they're learning from, the people that are like, oh, I don't know what to do with this. I guess just don't do the things that hurt.
Mm. That's
Or worse,
interesting. Uh-huh.
my I don't want to say favorite, the worst thing I've ever heard, is I frequently hear, just have a glass of wine and relax if like there's pain with intercourse. And I'm just like, why in the
Mm-hmm.
world would a doctor say that to a patient? That is
Mm-hmm.
just not acceptable.
So,
But it
yeah.
is probably the most frequent and most, I don't hear it a ton, but like of the enraging things I hear, I've
Mm.
multiple times. So
Mm.
they're just like, oh, it's in your head. You just need to like chill out and relax. And I'm like,
Oh
okay,
wow.
there's a little truth to that, but like that's very simplified, and like it's much, like we
Yeah.
need to talk about a lot more things around that. maybe,
Mm, wow.
maybe
Interesting.
relaxing and have a glass of wine is part of it, but like that's not the answer at
Mm-hmm.
all. And
Mm-hmm.
usually there's a lot more that can be done. But
Wow.
so
Wow.
that's my rant on that anyway.
No, no, very
You just
good.
asked me a question, I can go off.
That, well, I learned a few things just listening to that. But it is interesting to see how we have treated health conditions, in the body,
Yeah.
and the band-aid approach is what I call it a lot of times, but a lot of it is ignorance. We don't know, but I believe that anytime that we have a symptom, it
Yeah.
does need to be addressed and not patched over.
Hmm.
And so I do understand how you're telling someone, don't go do your exercise. And if anyone told me that, it's like, what do you mean? I mean, that's life for me. So I
Yeah.
can see definitely a very strong connection. And yeah,
Yeah.
okay, okay. So then when it comes to the pelvic floor itself, I'm sure, you shared about the like drink the glass of wine.
Yeah.
There are some misconceptions about what it is to have a pelvic floor problem. What are some of those that you can share?
Yeah, so there's a lot that is related to the pelvic floor. Obviously urinary incontinence, even retention. I think the
Mm,
biggie that people don't relate is actually constipation. I've treated tons of people that had, lifelong, constipation that we
mm,
treated, just treating the pelvic floor, and they're like, no, I've been to GI specialist and that specialist. And then I have an eval that just goes all over my screening questions, and like kind of, that helps me differentiate where their symptoms might be coming from. And usually I can pinpoint, and then combine that with the physical assessment. I can find like, oh, is your pelvic floor weak? Is it tight?
mhm,
So a lot of times tight pelvic floors, those people have constipation. That constipation backs up, sits on the bladder, causes urinary leaking. And then if you have a
mhm,
tight pelvic floor, you probably have pelvic pain. So I usually see this constellation of people that, it wasn't that bad, so they keep pushing through it. And
right.
then I feel like between the age of 35 and 55, like it starts catching up.
Okay.
So then women start coming and they're like, suddenly I had this problem. But then if I start digging, I'm like, you didn't suddenly have this problem.
It's been there for a
The
while.
signs were there. They were just yellow flags instead of red flags. So you
Uh-huh.
just kept on, because women are having kids, they're just like, I'm too busy. They put themselves last. The kids come first, which is understandable, but to a
Mm,
degree, but to the point that they're not tending to their health until it's like too, like, I don't say too late, but things have gotten much, much more severe. So, and I
mm.
think there's even a misconception of like, for intercourse, I've heard so many women say, I don't have pain, like, the normal amount of pain. And I'm like,
The normal amount.
normal amount? No, 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 no. This should feel good. Like there's a reason it's popular.
Okay.
Like
Okay.
it shouldn't, I mean, maybe on occasion you hit the wrong spot, but like it
Okay.
should not on a regular basis be,
Be hurtful.
be
Right.
painful. So and again, I think it's taboo because there's a lot of cultures and religion that kind of make that like this, you only talk about that with your partner. And even those people are barely talking to their partner about it. So
Right.
then they're not talking about their friends because that's not, you shouldn't talk about these things. And I
Mhm.
mean, and then I ask, my patients, like, why have you never said this to your primary care? They're like, oh, I was embarrassed. Or
Exactly.
even their gynecologist, they're like, well, I knew the exams are, uncomfortable. So I just figured this was normal. I'm like, no, you shouldn't be like in tears coming out of a pelvic
Oh
exam.
wow.
Like,
Oh wow.
so I
Okay.
think people just don't understand what they mean by uncomfortable. Like, yeah, it should feel like someone's scratching at your skin, not like you're about to
Hmm.
pass out or you're crying in
Hmm.
agony. So,
Okay. Okay.
um,
All
so
right.
there's just lots of misconceptions of that. But yeah, incontinence, constipation, pelvic pain, those are all things that I see. And, you have to remember, like if you think about the pelvic floor, like the anatomy, there's really nothing like, the pubic bone's in the front, you got the tailbone in the back.
Mhm.
And it's just there's nothing else there. So like your pelvic floor is in charge of everything, like holding everything up and in,
Mm.
the sphincters of the bladder and the bowel. Like there's sexual function. There's a lot going on there. Like
Okay.
it is
Yeah.
a literal
Interesting.
hammock or bowl of muscle, just like doing all the things. So when
Mm.
something goes awry there, usually a few things go
Goes off
awry.
a lot. It's a lot of things.
Yeah,
Okay.
usually. Yeah.
That's an
So
interesting picture. That is a hammock, and
yeah.
and holding things up. So then you deal with people who even like the prolapsed uterus,
Yeah.
things
Oh
like
yeah. Yeah,
that.
I forgot. Yeah.
No, no, that's
Of course
fine.
I
No,
did
it's just that when you
that.
gave that picture, I was like, it just made me think of people who have that diagnosis. I'm like, oh
Yeah.
yeah, because it's coming through. So
Yeah.
wow, okay.
Yeah.
So
And
then,
just to
mm,
clarify that, I think people hear bladder prolapse or rectal prolapse.
yes,
It's not actually the bladder itself. I've had so many people ask me, like, am I going to take a shower and look at the shower floor and my
I know.
bladder's on the ground? I'm like, no, 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 no. It's all attached. Like, you actually have the vaginal wall between your bladder
Right,
and,
right, right.
like, and even with hysterectomies and stuff, like, the edens are sewn and everything. Like, it
Mhm.
would take, you're not going to have an organ fall on the
You're
floor.
fine.
So
Right? Well,
I
thanks for
can't tell you how
clarifying.
many people have come panicked into my office, like, my bladder's gonna end up on the
I
shower
know.
floor. No, 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 that's not how that
I
works.
know. So that is true. I guess they take the visual to another level, but
Yeah, I mean, but they don't understand. They're told their bladder's coming out. Like,
right.
so of
Yeah.
course,
Yep.
like, you're gonna be like, what does that mean? And what's the worst case scenario? Where they're like, no, it's the wall that holds your bladder up.
Exactly.
Like,
So yeah.
it's not the actual bladder.
Well,
But
we
yeah,
know babies come out there, so it's like you kind of equate the two. So that's what it
yeah,
looks like when the
yeah.
baby comes. So that's what you
Give
have
birth to my
between the
bladder.
little bladder. Oh my goodness. Yeah. So anyway, that's why it's so important to clear up some of these misconceptions. And
Yeah,
it's really about a bottom line too is people understanding the physiology of the body and the anatomy. And I think a
yeah,
lot of times we have kind of kept that as like industry secrets.
yeah.
But the reality is that the more, this is why I feel I do work with patients, is the more I educate them. You
Hmm.
give them those visuals. Like I said, like your little hammock. You give them
Yeah.
visuals. You let them, I sometimes just show the picture and then just
Hmm.
explain because I think that also helps with buy-in
Yeah,
and helping
definitely.
people to really, really see, what they can do. So that's interesting. So then, of course, even if I share with if a patient shares information about the challenges they're having, what's the first thing they say? Oh, should I do Kegels? So
Oh God.
explain to me about Kegels. Do Kegels work? Are they appropriate?
Yes and no. So my annoying it depends response is with that. So
Mm-hmm.
I know a lot of people, if they know anything about pelvic PT, they're like, oh yeah, I do my Kegels. And I'm like, oh my gosh,
Right.
it's so much more than Kegels. And the number of people that actually come in that actually have a tight pelvic floor, it breaks people's brains because they're like, how can I have a tight and weak pelvic floor? Because it can be tight, but the analogy I give is imagine if your biceps got stuck and you're walking around with your elbows, super bent like chicken wings, like you're doing the chicken
Right.
dance, and
Mm-hmm.
you couldn't extend your arm. So
Exactly.
like what could you do with your arms if you were stuck in this like flexed elbow, like
Mm-hmm.
T-Rex arm, like chicken wings?
Mm-hmm.
You couldn't reach into cabinets, you couldn't open doors, or you could, but it'd be like very awkward.
Mm-hmm. Very difficult to get
Not
dressed.
very. Yeah. So
Exactly.
it's not
Yeah.
functional. So
Okay.
therefore it is technically weak because the muscle cannot extend and contract.
Contract.
So a lot of people end up with constipation, leaking, pelvic pain because they have a tight pelvic floor. So it's
Mm.
always interesting to me because everyone thinks the second they have anything going on down there, I must do Kegels. And I've had people come in that they're like, I was told to do Kegels even by their healthcare providers because of course they're also in the same boat because they don't know much about
Exactly.
what we do.
Right. Mm-hmm.
They're like, yeah, just do some Kegels. That's all the pelvic PT is going to do. And I'm gonna be like, oh, I do
Oh.
so much more than that. So a lot of times it's getting them to relax the pelvic floor.
Mm.
I always ask people like, do you get like really sore? Everyone gets the like shoulders up to your ears, so your neck
Mm-hmm.
gets like really painful and gets the knots in there.
Mm-hmm.
If your neck is doing that, your abs and your pelvic floor are probably doing the same because the two places
Mm.
stress goes is your neck and your pelvic floor. So if you're
Interesting.
gripping one, you're gripping the other, and your
Uh-huh.
pelvic floor is no different. So
Interesting.
like then
Okay.
your neck. I think we've like mystified the pelvic floor. I'm like, just think about how you feel when you're stressed and imagine what your neck muscles are doing.
I see.
Pelvic floor is probably doing the same. So
Okay.
take it like, take a deep breath, like shake it out, like
Mm.
try to relax all of your muscles.
Mm.
And just taking one really long, slow, deep diaphragmatic breath can calm the nervous system and release muscle tension. So if
Interesting.
you can just like throughout, I always tell patients, snack size self-care. Take a sip of water, take a deep breath. If you have another 10 seconds, do a quick body scan. Notice if you're clenching. Because, have you ever been at your computer halfway, you're like scrunched over the screen,
Mm-hmm. Shoulders are
shoulders up
up.
to your
Yep.
ears, and you're
Uh-huh.
holding your breath, and like,
Mm-hmm.
you're like, what am I
What am I
doing? I'm like,
doing?
oh,
Yep.
sit back,
Mm-hmm. Yes, so
sit
true.
back, drop your shoulders, shake it
Mhm.
out, take a deep
Okay.
breath, like slow your breath down, or actually breathe and not hold your breath.
Okay.
So
Okay.
yeah, it's not all about the Kegels. It's about the coordination of the pelvic floor. It's about if it is tight, we have to relax the pelvic floor and get length to it before we can even, and then it becomes just weak, and then we strengthen it once we get that length to it. But if you're starting with a tight pelvic floor, like doing Kegels would be the worst thing. So
Mm-hmm.
um, and that's what's hard. That's what's good for people to go in to see a provider to like make sure, am I doing it correctly?
Mm-hmm. Okay.
I even have had women come in before giving birth to be like, can you just check my pelvic floor? And I've had a few that they thought they were bearing down and they were squeezing and they had a tight pelvic floor. And thank goodness they came in
Oh,
because, if you're pushing, it doesn't matter if you think you're bearing down and you're actually squeezing your pelvic floor because your pelvic floor doesn't like to relax.
I see. I see. Yeah, but it's that body awareness.
Yes, yes.
Sometimes you need that external kind of looking at somebody to look at it to be able to go, oh no, it's actually quite the opposite.
Yeah.
Wow.
So it's
Okay.
not all about the Kegels. A lot of times you need the opposite, but
Okay.
sometimes it helps. Like
Mm-hmm.
obviously if there's nothing else wrong and it's a little tiny bit of leaking, you don't have constipation, you don't have pelvic pain, it might be, weakness. And then and Kegels, it's just called Kegels because Dr. Kegel discovered the muscles, so it gets named after him. So it's the
Mm-hmm.
synonymous with pelvic floor contractions, and it's the same muscles you use to stop the flow of urine or hold back gas.
Mm-hmm.
So yeah, just doing you could do short squeezes, long squeezes, but that I'm almost like afraid to tell people that anymore because the number of people that then come in and then they're like, well, now I have pelvic pain, and I check their pelvic floor and it's tight. I'm like, oh,
Mm-hmm.
you had a tight but weak pelvic floor, and then we just
In the
made it
first
tighter
place.
by doing more Kegels.
Okay. Wow. Wow. Yeah. So just listening though to the kind of it sounds like it's a conflict that you're tight
Yeah,
and weak.
yeah,
So yeah, you definitely need to
It's
speaking for someone who knows
counterintuitive.
how, yes.
Like,
Yeah.
how can my weight get tight? But that's why I use the little chicken wing analogy,
Mhm.
because it's the
Yeah.
only way that it makes sense to people. They're like, oh yeah, I guess that would be annoying if you did bicep curls to the point where you couldn't extend your arm anymore, and then you're walking around doing the chicken dance all the time.
Right, all the time. Yeah, non-functional. Yeah,
It,
hard to get
you
dressed,
can't do
put on
anything.
favorite clothes. Yeah, makes
Yeah.
sense. Wow.
Yeah, try to
Okay.
get your arm through a sweater sleeve with
Uh-huh.
the arm
In
bent.
that position. Yeah. Very interesting. Okay. So with your certification, you
Mhm.
went through the Herman Wallace. And so as a practitioner, you have been trained to look at, the pelvic floor globally, so to speak.
Yeah.
And so that is something that you put into practice right now. I mean, you use all that training. So what are you specifically doing as far as do you have a clinic? Are you online? What do you do with your skills?
Yeah. So I am moving to a pretty unconventional model. So I'm really like, I want to get you the solution. I'm not like, we're not trading, we're not trying to be like, I have to see you so many times, because I think that's very common for PT.
Mm-hmm.
So it's virtual PT with mobile PT options, meaning like, because I feel like I'm finding a lot of what can be treated is actually like really just talking to the person, getting their story, and
Mm-hmm.
it's a lot of behavioral stuff. Like the
Mm,
one example is the people that think they're hydrating, but they're slamming like a bottle or two at a time and then otherwise not drinking at all. So
right.
they're dehydrated, and
Mm-hmm.
then like drinking way too much and they're overwhelmed. So then they're
Mm-hmm.
running to the bathroom and have urgency and all that.
Mm-hmm.
So stuff like that, like I don't need to see like in person to do that.
Right.
But we work through all those things. So we do a lot of virtual PT, and then maybe check, it opens up doors to like, hey, take me with you to your gym and set up your phone so I can watch you do the workout that you say you leak during. Or
I
like
see.
it gives more flexibility. Like I want to know what your life sounds like, looks like, and see like what the triggers are. And then if and when needed, like I'm like, we got to really check that pelvic floor because I think it might be tight. I think it might be this, or you might need some manual therapy. Let's schedule like an in-home visit to like assess that.
Mm-hmm.
Um, and we could even possibly be self-directed over, telehealth, or over like
Mm.
the virtual video call.
Oh, okay.
So
Very interesting.
um, yeah, so then I can be like, okay, you can check this. Does this hurt? Or,
Mm.
but at a certain point, like I'm the one that has, assessed, at this point, thousands of pelvic floors. So I can
Right.
do it in 2 seconds and be like, yep, that's tight. Nope, that's weak. That's nope, it's your endurance. Nope, it's
Mm-hmm.
your speed. And I can figure that out in 5 minutes. And a person that does, they're like, I've never even touched my own pelvic floor, let alone
I know,
anybody.
right?
No, I don't know. This is normal for me. And I'm like, nope,
Uh-huh.
nope, it's not normal.
Okay.
But anyways, so it's going to be virtual and mobile. So mostly virtual with like mobile options if they're in Massachusetts, because I'm in Massachusetts,
Mm-hmm.
Western Boston. So western suburbs of Boston. But yeah, and I want to help reach more people because there's, Western Mass is kind of more rural almost.
Okay. Okay.
So not, it's very condensed towards Boston. So a lot of people are having to drive to Boston. So what can I do for the busy parents and professionals that are just
Mm-hmm.
like between childcare or work schedules and whatnot? Like, how can I augment that?
Okay. Okay.
And I'm growing it. I want to have like group calls and online community and all that, but I'm in the process of building that empire. I
Okay.
want to I would love to take care of everybody.
I know, right? That's the bane sometimes of the PT, but yeah, we
Yeah,
like to help as many people as possible. So that sounds great. And so you're in Boston, you're in Massachusetts, and so
yeah,
I know there's kind of that state licensure, but your
yeah,
virtual component
yeah.
can
Could
expand
be anywhere.
that.
Yeah.
Okay, very good. So,
Because it's education, like a lot of this behavioral
exactly.
stuff, like just there's several tips on this call today, or like things that I work with my patients that like have fixed
Mm,
them. Like, hey, sip your water instead of chugging your water. And then they come
mm,
back, they're like, oh, like now I don't have urgency anymore. And I'm like, yeah, because you were overwhelming your bladder repeatedly.
right. Okay, very
Of course
good.
you can have urgency if you drink 20 ounces of water in 2 minutes.
Uh-huh. I know. Where is it supposed to go? I tell them it's
Yeah.
like a shower inside. It's good first thing in the morning, but after that, you need to drink it till it stays in. So
Yeah. Yep.
very
Yep.
good. Okay. So then, Tanya, where would people be able to find you? And we'll put this in the actual
Yeah.
narrative part of the podcast. But where could they find you if they want more information about what you do?
Yeah, so I'm on a lot of the social media platforms. So TikTok, I'm Dr. TMI. YouTube, I'm TMI Doctor. So that's all confusing because the handles are all flipped. And then Facebook and Instagram, I'm Yanok PT. So my last name's Yanok. So Dr. Yanok PT. So Yanok PT is the handles for those.
Okay.
So I've been trying to increase that and giving tips on there as well if you want to follow for more tips,
Okay.
just general information. And yeah, so
Yeah,
that
we'll
would
be
be where you
sure
could
to
find.
share the links with the audience so they can
Yeah.
find you, and then maybe in the future they'll be able to join one of your virtual platforms that you do.
Yes.
And I
Yes.
will tell you, this has been informative. I
Good.
appreciate you taking the time to do this. Now, what I do like to do, though, I want to ask you a couple of
Mhm.
just kind of trivia questions.
Oh
So,
gosh. Oh no. I'm
no, no,
horrible.
no, they're easy. I'm going to keep it easy because I didn't totally forewarn you. Okay.
Okay.
All right. So, very, very simple, basic things. So, if you could eat one cuisine every day for the rest of your life.
Oh man. One cuisine. I don't know. It might be, I don't know, fried egg on avocado toast. And the toast has to be rosemary bread.
Oh my goodness, quite particular.
Yeah. It's
That
it's one
sounds
of my favorite breakfasts. And I'm like,
okay.
I could eat eggs all the time. It just makes my body happy. So and
Okay, so
and
eggs is the center. Eggs Benedict,
avocado,
avocado. Okay.
rosemary bread, you know.
Okay, okay, all right. And what has been your favorite place that you've traveled?
I was in Chamonix and I climbed one of the mountains
Oh,
and it was a magical day. I ended up like following there was a little trailhead like just sign that had a wine glass and a coffee mug with an arrow and just for like hours I followed this and it took me up a hill that had a ginormous waterfall. So I was like sitting
oh,
on this deck with flowers being fed like espresso and an omelet watching like a 60-foot waterfall.
oh
And
my.
it
Okay.
was like the most, and I was by myself. It was the most magical experience
Oh,
ever.
oh, nice.
So
Okay.
that's, I mean, I'd probably go back a million times and that would never ever happen again. Because then even as I was leaving, like I got the bus back to town and like there was a double rainbow over the mountains and I'm like, what is my life?
Oh my goodness.
So that can never be replicated. So
Okay, yes,
for
that's true.
Chamonix, that was
That was for
gorgeous.
you. Mhm.
Yeah.
Very nice, very cool. So, all right, well, just like basic little questions, but just to get a little insight about who you are and what you enjoy as well. So, but again, I do thank you for taking the time to join us today. And
Thank you so much. Thanks for having me. All
yeah, you are welcome. All right, we're going to sign off. And again, thank
right.
you for joining us on the podcast today. And
Yes.
we will meet next time.
Yes.
Thank you for joining us on this episode of Pain Free Pathways, and we hope that you found valuable insights and practical tips to help you on your journey to living a pain-free, active life. Be sure to subscribe so you never miss an episode, and if you enjoyed today's discussion, please leave us a review. Your feedback helps us to bring you the best content, and we ask that you join us next time as we continue to explore the power of natural healing and recovery. Until then, stay well, and remember, we are dedicated to restoring your health.